Anemia. Definition of anemia. Anemia can be defined as a state in which blood hemoglobin level is below the normal range for the patient age, sex, and altitude of residence. So here what happens, the blood hemoglobin level decreases below the normal range. So we should know the normal range. The normal range varies gender wise and in different age and altitude. So the normal range for male is 13 to 16 gram per dl, and in case of female it is 11.5 to 15 gram per dl. Anemia can be classified by two ways, based on the cause of anemia and based on the morphology of red cells. Based on the cause of anemia, it can further be classified by three types. That is due to blood loss. Blood loss can be acute or chronic. Second one is due to inadequate production of normal red cell, and third one is due to excessive destruction of red cells. In blood loss anemia, there is loss of blood, which may be acute or chronic. In inadequate production of normal cell, there is defect in production of red cell, that is the red cells are not produced normally. And in third one, there is excessive destruction of red cell, in which the red cells are produced normally but they are destroyed after formations. So by these three types, anemia can be caused due to based on the cause of anemia. Now, based on the morphology of anemia, it can be divided into three types: normocytic anemia, microcytic anemia, and macrocytic anemia. In normocytic anemia, the size of the RBC remains same, that is normal size of RBC, but its number is less. In microcytic anemia, the size is not normal, the size is small, often hypochromic red blood cells in peripheral blood smear, and usually characterized by low MCV, that is MCV is less than 83 FL. The most common examples of microcytic anemia is iron deficiency anemia. Other examples are sideroblastic anemia, thalassemia, etc. Microcytic anemia. Macrocytic anemia. In macrocytic anemia, the size of the RBC is not normal and it is larger than normal size. The MCV, that is mean corpuscular volume, is greater than 100 FL. Etiology of different types of anemia. In blood loss anemia, there is acute blood loss anemia and chronic blood loss anemia. Acute blood loss anemia is caused by trauma or postpartum bleeding. Chronic blood loss are caused by bleeding in peptic ulcer, hookworms, excessive menstrual loss, hemorrhoids, etc. In inadequate productions of normal red cells is caused by deficiency. In deficiency, there is iron deficiency, vitamin B12 deficiency, folate deficiency, endocrine deficiency like hypothyroidism, hypogonadism, hypopituitarism, hypoadrenalism. Then there may be marrow failure like hypoplastic anemia, aplastic anemia. There may be marrow invasion like leukemia, secondary carcinoma. There may be due to toxic factors like chronic inflammatory and infective disease, renal failure, hepatic failure, etc. It may be caused due to maldevelopment like sideroblastic anemia, thalassemia, neoplastic disorder of erythropoiesis. Then hemolytic anemia, that is excessive destruction of RBC, may be genetic and acquired disorder. Genetic disorder due to red cell membrane or hemoglobin or enzyme abnormalities. Acquired disorder are immune, toxic, mechanical, and infectious causes.